by Alyssa Maranges, Gabriella Maranges, Mikayla Plummer, and Taylor Shore. In this video, we will discuss 4 different aspects of in vitro fertilization. First, we will define in vitro fertilization and describe the process. Second, we will present the positive aspects of the process and the arguments supporting it. Third, we will explain the negative aspects of it and the arguments against it, as well as the Church's feelings towards it. Lastly, we will discuss the pros and cons of the issue. In the following skit, there are 4 characters: a doctor, a single woman seeking to conceive by means of IVF, and a friend of a woman who supports it, and a friend who opposes it.
It will be played by Mikayla Plummer. The patient is played by Alyssa Maranges. The supporting friend is played by Taylor Shore, and the opposing friend is played by Gabby Maranges.
Hello, Dr. Plummer.
Hi.
I'm a single woman and I would like to have a baby. I've done some research on in vitro fertilization. Can you give me some more information?
Vitro fertilization is the process of manually combining the egg of a woman with the sperm of a man. It's not 100% guaranteed, but it's about a 96. The steps include stimulation, egg retrieval, fertilization, embryo culture, and embryo transfer.
Further explain these steps.
First step is stimulation, where we're going to give you fertility drugs to stimulate your egg production. A woman produces 1 egg per month, but with these fertilization drugs, you'll be producing 2 to 3 eggs every month. Step 2 is egg retrieval. During this step, you will receive a minor surgery called follicular aspiration. It's the surgery to remove your eggs. You will be given anesthesia so that you will not feel any pain during this surgery. Using ultrasound images as a guide, we will insert the needle through your vagina and into the ovary and sacs containing the eggs. The needle is connected to a small suction device which pulls the eggs and fluid right out. The third step is simply fertilization. This is where we'll take the male sperm and place it together with the best quality eggs that you have. The mixing of the sperm and the egg is called insemination. The sperm usually fertilizes the egg within a few hours of insemination. Step 4, it requires no work on your part. It is embryo culture. This is where we will be taking the sperm and the egg and putting them together to see if they will fertilize and become an embryo. Step 5, embryo transfer. Embryos are placed into the woman's womb 3 to 5 days after the egg is fertilized. I will be inserting a thin tube containing the embryos into the woman's vagina, through the cervix and up into the womb. If an embryo sticks in the lining of the womb and grows, a pregnancy will result.
What do you guys think? Although in vitro fertilization has increased in popularity and ultimately benefited or not, few people are aware of the impactful role it plays in our lives. It has its pros and cons. When I researched IVF, I found that it is a complex series of procedures used to treat fertility or genetic problems and assist with the conception of a child. During IVF, mature eggs are collected from the woman's ovaries and fertilized by sperm in a lab. Then the fertilized eggs are implanted in the woman's uterus. I also found that the women will face and endure much pain and suffering in pursuit of much heartfelt desire to bear a child.
I support your decision. In vitro fertilization is a simple and affordable procedure. You can have a child without a husband. I think it's a great idea. Good luck with your procedure.
The pros of IVF is that the women, like me, who would never be able to have a child, now have the hope and blessing of being a mother and a controlled birth defect. Also, in vitro fertilization can be a God-sent procedure for some couples and single women like me. One of the cons is that the embryo is created in a petri dish. It is known to be one of the safest procedures to conceive a child. Before making the final decision, I wanted to sit down and view all the risks that can come with this procedure. There can also be risks that affects both mother and child. One is during ovarian stimulation, women can get ovarian hyperstimulation syndrome, which causes swollen and painful ovaries. About 30% of in vitro fertilization patients experience at least a mild case of this syndrome. 2. is that the baby will be born premature or with a very low birth rate. 3. About 2% of women who use this procedure will have suffered from ectopic pregnancy. Ectopic pregnancy is when the fertilized egg implants outside the uterus, usually in a fallopian tube. The fertilized egg cannot survive outside the uterus, and pregnancy cannot continue.
Teachings of the Catholic Church state that in vitro fertilization harms the body of the woman, the relationship between a married man and woman, and takes away the sanctity of procreation. First of all, if you want in vitro fertilization, you should be concerned about the well-being of not only your own body, but also the baby's. Oftentimes, a woman resorts to IVF because of her inability to create a zygote or an embryo. The carrier, the mother, may not always have the necessary nutrients to give to the embryo, the baby. Luckily, this isn't the case for you. You may become depressed due to the immense amount of additional physical and emotional stress you receive from this process. Concentration on conceiving through IVF may also cause you to neglect your friends and extended family. The Church also opposes implantation of a woman's egg by means of a donated sperm because this process is similar to the sin of adultery, because the sperm is not derived from the husband of the woman who is attempting to conceive. Lastly, the Church opposes IVF because it takes away the sanctity of procreation. IVF creates a petri dish baby in the sense that when the sperm is removed from the man and the egg is extracted from the woman, the two gametes are placed in a petri dish, creating an embryo. This embryo is created with the help of technicians and scientists, virtually removing the human element of creating with God. By removing the act of procreation through intercourse, the populating of the earth is no longer carried out in the way God intended, with our help.
I think I can make an informed decision now.
You're welcome.